Pallavi.
Hi, good
Good
morning.
yes, good
Afternoon.
afternoon, Jammu. Can you hear me? First question.
Yes,
Okay,
perfect.
good. So I was thinking I was calling you in case I thought if there's a glitch or something, we can work on it. So we have a good friend of mine. You know her too, Manu. I told her she knows all the answers from within for the skin.
Okay,
Yes.
hi Manu.
Yes. She's saying hi to you as well. All right. So let us start the live. Okay. I'm so happy. Thank you so much for joining in and accepting my request because I want to see whatever I say is different, but what comes from you, it's from the expert's mouth. So that's what we want to do. And a lot of people have questions, and I thought let's add some value. So please officially welcome to the live, and let's make it a rocking live. Those people who can't join
My
in,
pleasure. It's
they
my
can.
pleasure to join here,
Thank
and
you.
definitely we are looking more for this kind of lives. So thank you so much for inviting me here
My
and
pleasure.
giving me an
Good to see
opportunity.
you. Good to see you. And at the end, we are recording this, so those who miss it also can access it, and we leave your details. Also, they can get in touch with you
Right,
as
right.
well. So first thing, I have my question list ready, and first question is this. I would like you to just introduce yourself for all the people who don't know you. I know you, but all the people who don't know you. So just a brief.
Okay, so I'm Dr. Pallavi. I'm a skincare, hair care, wellness expert, especially for women. So wellness with the skin and hair, definitely the wellness comes also together because we have to work on all the aspects, not only on skin or not only on hair, but it includes 360 degree of your life because women's are multi passionate, multi working everywhere. They have lots of stress and things to do. So I really work on skin as well as the other things for the women so that they have the best skin and they come out to be in their best and confident self.
I
That's how I
agree
am.
because I think it's a holistic approach. You can't just focus on one aspect. That's why Manu has the internal answers and you'll have the medical related answers. I have some knowledge and experience based stuff, but anyway. So first question, I think it's a question which is best answered by an expert like you. Are skin conditions basically genetic or environmental? It's a big question, big one. That's my first
Okay.
question.
Yeah. So genetics actually decides everything about you. So how it would be going to your texture of hairs, how the density would be there, what kind of skin you will have. It would be dry or it would be oily. What kind of oil glands will you have? I mean, they will be small or more
Okay.
density oil glands will we have on your face. So this is all decided by your genetics. Okay.
Okay.
So but genetics alone cannot do until they have precipitation factors, right?
Okay.
So the environmental factors decide that how it will go. So genetics is the
Hmm.
primary thing which decides all your body, and then with the environmental factors and precipitation factors,
Hmm.
the disease comes up and flares up, and
So,
it's
so is it true that if a mother had a good skin, most likely the daughter will have, but may not always be correct also, right? Like you said, precipitation factors.
Yeah, so only mother won't decide your genetics. It's your
Correct.
father, mother, both will decide your genetics. So sometimes your mother can have good skin, but it doesn't mean that the color of the daughter would be the same as of mother. There
Hmm.
would be different kind of melanin pigment and the density of melanin cells will be different. So that
Correct.
is the
Correct.
difference that is decided by the genetics.
So suppose, okay, just it's connected to this. So suppose someone had bad skin, say in the family, like mother, father, whoever. Now, if the child who's an adult now, if they take care, will they be able to help themselves with the right guidance? That is my question.
Definitely. So
Oh,
God
so
never
that's
makes
cool. That
bad
gives us
things.
hope. That
So
gives us
first and
hope.
foremost thing we need to understand, God never makes bad things. God always make the best thing. It
Correct.
is your routines and your care which make it more perfect, right? So
Lovely.
it's all about your perfects and routines and how you work on it. That decides how it will look and how it will come out.
Okay, so at least it gives hope for the people because a lot of women say, oh, it's bad skin is in my family and all of that, So then that's not, then you feel like, is it only your, genetics or is it something else? So good.
Yeah,
I'm so
so
glad to hear that. There's hope for all those women who are struggling with skin issues. That's what my goal
yeah.
is to of this to hear it from the expert instead of me saying or someone else saying it, you know.
Right.
So thank you so much. That one question cleared. We had a question from one of our viewers who had just joined 5 minutes earlier when I joined, but I think that will come towards my question three is that question. So I will ask her question in my question three. Most of the questions will cover everybody's doubts, I think, but still, everybody, welcome all whoever has joined in. Minu had joined in. Minu, welcome. And yes, someone else, Sadiq, welcome. Okay, so basically, there's hope, even if it's your genes, but there's still hope. So that's number one answered. Question two: can acne be treated? And if yes, I mean, to what extent it can be treated? That's one question.
Okay. So there are two different terms. One is treatment and one is cure. Most of the people are looking for cure ki once they have taken the treatment, they should not come back. So
Huh.
that is really difficult. That the reason because acne is coming up because of the oil glands activity, and then there are the precipitation factors, right? So we can treat the acne with the treatment, the medical medicines which we apply on the face, the medicine which we eat. That is how it is treated. And then we maintain our schedules and skincare routine, which delays the process of coming up of acne. So you have to take certain precautions which can delay, but till the time you will be having your skin and having the oil glands in it, it can
Hmm.
definitely come up. Even with the best treatment, and
Hmm.
even if you are taking the oral medication for long, for 6 months,
Hmm.
even then one, two, three can pop up again till the time the glands are active.
So this basically means that routines and proper consistency has to be there in those routines. And also
Right.
you can't like stop treatment. You started for 1 month, then you left it, then you're back. So basically the skincare routine is very important and consistency in that routine.
Very
And then with the
important.
right treatment. Thank you, Mino. She's saying happy to see the two of us together. Thank you. Mino, you can also ask any questions if you have. Please go ahead. So I'm happy to hear the answers because it gives everybody so much hope because like I'm also into makeup as you know. So one of my the person who took my makeup course, she had acne. So I was asking her, have you taken treatment? Did you go to a skin specialist and all? So she was saying nothing is working for me. So I was thinking, no, it's not like that. But let me ask, from someone who's into the field. But so today, I think her question will be answered. She probably didn't do the routines because she was saying, I did, then I left. You have to be very consistent, right? It's
So,
like
so
anything.
I always tell my patient, skincare is just like brushing your teeth. You have to do it daily.
Correct.
Or, or if you are someone who is losing your body weight and you are doing dieting and you are doing exercise, and if you don't do it after 6 months, then there are high chances that you will put on your body weight again, right?
Exactly.
So
So happy to
anything,
hear.
nothing is permanent. So you
Correct.
have to do consistent effort so that you can maintain what you have achieved. So once we achieve the result and then we maintain it. This is how we go.
So happy to hear this, and it gives me and everyone out there hope that you have to put in your effort and leave the rest to the experts. I would say that in this case, especially for the skin. Okay, now this is the third question, and this is what one of our viewers who had joined in, she had asked, Surbi, dark spot. What are the causes of dark spots, and what are the possible treatments? So first, we can deal with the causes for dark spots as
Okay,
a
so
layman, as a person who
yeah.
doesn't have that
So
much knowledge.
as a layman, I would say, see, there are multiple factors, again, multiple kinds of dark spots. So first we need to examine and then we decide what is it kind of. But if I would say the most common kind of dark spots I am seeing in my OPD, so one is sun tanning. So sun
Okay.
tanning is very common problem which creates dark spots on your face. Then
Hmm.
second is melasma, which is called jhaya in Hindi. This is also
That melasma,
again a
what's the difference between melasma and a regular sunspot? Is there a difference there?
yeah, definitely, definitely. Melasma is, melasma is having a I mean, a pattern. It is bilateral on your
So sorry, I don't know what happened. It just switched off, and then I had
some
to.
technical glitch was
Yeah.
there. Yes.
Anyway, we're back. So we were at, in case, I think right now it is only one somebody else.
We're talking about the black spots, right?
Yes, yes. Melasma. No, I was thinking that I thought I have seen someone that had like a bigger black spot on their face. Then, but I guess so. I didn't know the difference technically. What was the difference?
That needs to be examined only. Then only we decide that we have to go for the melasma treatment, or then there is, pigmentary demarcation lines are there. Then
Correct.
there is blemishes, which we call as freckles. And
Correct.
then there is acanthosis, and sometimes there are, allergic contact dermatitis, which
Mhm.
creates pigmentation on face, and then due to over body weight, and the most common is post acne, mark remains there. So after the acne, it leaves, black spots, and any kind of inflammatory condition can leave the dark spot. So we have to first decide which kind of dark spots it is, and then we start the treatment accordingly.
First step is identifying, like for a layman, everything looks dark spot, like whether it's a big patch or a small patch. But what you are saying is from a doctor's perspective, first you identify what kind of dark spot it is, if it's just a freckle, just a simple sunburn, or something more,
Right.
then deal with it accordingly. So this is I think for all the viewers who are live now and all of them who will watch it later, I think it's a very valid point because we just treat as a layperson, we just say dark spot aa gaya, but क्यों आया, what is the exact reason, that's where you need to take help at the professional level. So I think that was very enlightening for me also, because that was the question we had, the first question about dark spots. So for our viewer, I would say that please go and consult. Do you do live consults also, like, but or you prefer in person consults?
So we do give the online consultation. So we have this facility available with us for online consultation for the distance patient, and mostly the patient who are coming first time and are staying far away, then they take online consultations. That's how
That
it works.
any one of the viewers want to consult from anywhere in India, they can get in touch with you. That's good.
Definitely.
That's nice. So, yes, the next question is important. I think all of them I feel are important, but the next one is what are the effects of stress on the skin and what are the treatments you suggest?
Okay. So stress, definitely, it is affecting our life everywhere. So what happens is whatever exactly our skin condition is, it aggravates that condition. Okay. So how it happens, whenever stress is there, our body, creates stress hormone. Now
Mhm.
that stress hormone decreases our normal resting. What does that stress hormone do? That actually decreases your resting phase and increases your fight and fear reactions in your body. Okay,
Correct.
fight, flight, fear. This is how it is increased. So you become active. So your blood sugar levels become more in your body. Your sleep decreases. Okay, so your uh, when this is all working on major level, and then at minute level or minor level, what it is doing is it increases the sebum production. So oiliness of skin increases. The barrier function of the skin decreases. So eczema condition aggravates. And when
Okay.
you are not having the sleep properly, then you start scratching your skin. Your habits changes. You do not soothe up your skin, but you scratch your skin. So this is how indirect impacts come on your skin, and then your body immunity decreases. So all the conditions are aggravated indirectly with your stress. Okay.
Correct. That makes a lot of sense because today we are dealing with skin specifically, but obviously it affects other body. But right now, for people who are, that's why they say if you are like if you are having sudden outbreak on your face or something, which you never had, so then you need
Acne
to.
increases whenever a marriage is coming. Every time I'm having one or two patients just before 10 days or 15 days before their marriage. Okay. And then I'm having patients who are having exams, and their skin is outbreaking with the pimples or acne. So this is how it is interrelated, because we are not completing our sleep, we are more active every time. So that, your lifestyle changes, your food changes, everything changes. So that impacts your skin.
So very important for anybody who is getting married as a bride that they need to take at least try and keep the stress away, though it's very difficult, I think, at the time. But still,
Right.
you want to look your best, so then you need to try and manage it for that. So for everything, I guess the reason has to be identified. What is it, and then what's going wrong
What's
in
going?
your body,
Yeah.
and why it's affecting your skin. So this is the protocol, I think. First, find out what type of issue it is and what are the possible causes for it. And depending on the causes and the reasons, you go for the treatment then.
Right.
So
So
that
when
a lot of people think medicines for acne are not good. What is your opinion on that? Since we are talking about stress and acne and all that.
Yes, so acne can be treated by themselves. Actually, if we will not treat it, with over the time it will get resolved. But the problem is what? They will come up again. Okay.
Again.
And second thing is, when you will not treat it, the consequences are so bad that it impacts your skin for lifelong, actually, because if the pigmentation stays on your face for
Yeah.
long, then the scarring remains and that stays on your face on for long. So the if scarring once happen, you can't treat it 100% even with the lasers, so your skin will never be normal as it was earlier. So that is the reason, I always say, if you have acne, you should first thing, you should go for with the visit to the doctor. Why? Because first day he or she will counsel you about your skincare, what you need to eat, what you need to, how you need to take care of your acne. And once you know about it, then you know how frequently or when you have to go to doctor when acne burst out on your face. So first visit you should definitely make earliest, and then according to your situation, you can plan your
Yeah,
visit.
because what I have seen this attitude, I think now with the newer generation, they are more aware and they have a lot of knowledge, which I think in our times we didn't have that much. So a lot of people would say, oh, this is part of growing up, so just go ahead with it. But I don't think that is the
This
right
is
approach.
normal. Yeah,
Yeah.
this is this age, this is normal, so don't worry about
Yeah,
that.
it's normal to get it, but how about going ahead and finding if there's anything you can even do about it? If you can't do it, the doctor says, sorry, I've checked all your conditions and now we can't do much, then it's a different story. But most of the time, there are treatments. That is what I want the
And
awareness.
especially for the teenage group, I always say, because they are just in teenage.
Exactly.
The acne will come till 20, 25 or 30. So they should actually be aware of their skincare at the beginning only. And they are not aware of popping it up. They should not pop it. Okay. So what they do is, if they are not going to doctor, they themselves getting it treated. But they are actually harming more to their skin by doing that. So they need not to touch their face or pop it out, because that creates more bad consequences. Right.
Exactly. Like I just feel like being helping everybody out there, whether it's a teenager or anyone who's struggling with it. It's only when you go through it you realize what it is. So I personally did not have skin issues till the age of 19, and then suddenly my forehead had a breakout, and then that was the first time ever I needed to go to a skin doctor. But what I realized that if you stringently I followed all the medicines instructions and it cleared up, because on its own it was not clearing up. So till the age of 19 I never had a problem. In the 19th year I had it. But what I realized, I became wiser after that. That's why I'm interested in this topic also. It actually helped me. The doctor was able to help me and then restore it, and it took a few months. It was only in the forehead. So she told me, you are lucky it is only in the forehead, because here there's not many chances of scars developing, because there's not much tissue here. It's mostly bone. So I still remember that as a 19-year-old. So, but I was happy I took action. So what I want people to understand is take action about your health, which also includes your skin. Don't just think कि ये तो होता ही है, ये तो होएगा. No, there is treatment. There are people with the right knowledge, and you need to go and, you know, do that. So I'm so glad that we talking on this topic. It's a very topic close to my heart, because when you see someone suffering with acne, with skin issues, and they feel they can't do anything about it, and that's where I want to educate people that no, you can do, at least go to a doctor, find out, then and be consistent in your treatment, and then figure out, then decide, okay, no, it didn't work for me, because I, I think it's important to look after yourself mentally, emotionally, and physically, which includes our physical health as well, right? So,
Definitely.
so stress is like the problem with, I think, with everything. And next is a very important question, which I got to know just a few years ago. What is your like what as a doctor you would have to say about vitamin D and sun exposure? Because I will share my thoughts at the end, what I got to hear, but I don't know how much of it is true or false. You tell us as the doctor.
Okay, so vitamin D definitely is created in skin with sun exposure. Okay, but with lots of concerns coming up with the pigmentation and photoaging. See, sun always damages your skin. It damages your collagen loss is there. The pigmentation is coming up. This is why the dermatologist tells you. And then there are some, more diseases which happens more in Western world in lighter skin, not that much in darker skin. Okay, so that is the reason we always advise to, have strict sun protection. Now, whenever I tell my patient and they say, "फिर ma'am, vitamin D कैसे बनेगा?" Okay, so this is another question they have in their
Yeah,
mind.
I think it's a very important.
So
Yes.
vitamin D, we already have that much exposure in our body, and why you need only the face part? You can, though, if we are talking about pigmentation and photoaging, we are more concerned about our face, right? Though we should cover our body also, but then if you really want to sit in sun, this is for those who are willing to sit in sun, especially in the North India where winters are very high end and people enjoy sitting in sun. So then you can cover your face fully and then go and sit in the sun. That can be one possibility, and just for few minutes, not for long hours. That is one thing. Second thing is, even even we do that, we find vitamin D deficiency mostly in females. So if you have deficiency, then you take supplements, because sun alone is not completing your need. So we need to take the diet and supplement for vitamin D after certain age and certain years. So that is how we suggest it to the patient.
So before I say thanks, I just acknowledge some of the viewers here. Thank you, Priyanka and Sejal, for joining in, and also Tans who joined us. So please let us know your questions. I am asking all the my favorite questions, but I'm happy to. I mean, Dr. Pallavi will be happy to answer all your other questions here. So this is a very important question. That's why thank you for clearing this doubt, because I was deficient in vitamin D some time back, and the doctor who was guiding me, he said, "Don't stand in the sun. Don't think कि धूप में खड़े होने से you will get the vitamin D, because उससे you will just get tanned and nothing else. So take the supplement." So then I was guided towards it. So there are so many these misconceptions about skin we have in our country also. धूप में रहना चाहिए, you'll get, your bones will get stronger. So I want us to be able to educate people. No, it's not always about just धूप में जाना चाहिए and all that. It is also about have the knowledge and then go. And I think also early morning sunlight is considered to be there, right? Like that is what is considered, that maybe I think before 9 a.m. something. Yeah, that
Not
is the
before 9. It's 10 to 1 is the highest peak of sun over there in the North India. So somewhere around 9 to 11 is the best, sun rays which you can take, but not more. I think 10 to 15 minutes are sufficient, not more than that.
Okay.
Few of the
Yeah.
viewers are interested in Hindi listening.
Okay, so we can talk in Hindi and English. Let's have a mixed conversation as per the. तो अगर आपके कोई क्वेश्चंस है तो प्लीज इसको कमेंट्स में जरूर लिखिए. अभी तक हमको ये समझ में आया है. आई जस्ट डू अ लिटिल रीकैप. विल डू एट द एंड आल्सो द रीकैप, बट द बेसिक थिंग आई हैव अंडरस्टूड, मुझे जो समझ में आया वो ये है कि जो भी आपका प्रॉब्लम है, आप पहले उसको समझिए, वो प्रॉब्लम हुआ क्यों, और उसके बाद उसका जाके डॉक्टर के पास, स्पेशली स्किन डॉक्टर के पास सही इलाज करिए, तो आपको उसमें फायदा मिलेगा, नहीं तो अपने आप से हर चीज करने से नहीं होता है। तो दैट्स व्हाट वी हैव लर्नड। और विटामिन डी धूप में खड़े होने से इतनी नहीं मिलेगी आपको जितना आपको डैमेज होगा, ये बहुत ही इंपॉर्टेंट पॉइंट है। Next is the question. Thank you so much for that clarity. Now I'm also feeling empowered, okay, because I would always sun protect myself right from my college days. And sometimes people would tell me, कितना protect करोगी अपने को, कितना sunscreen लगाओगी, you know.
But
So that was
that's the right practice actually. We have to do it frequently, and we have to do it on all the exposed part, not only on face but also on neck. And so, few people are allergic to sun also. Then we have to tell them that you can apply.
that's me. I discovered it only 2-3 years ago and I never knew, मुझे पता ही नहीं था सन एलर्जी भी कोई चीज होती है। I said सन से कैसे एलर्जी हो सकती है, वो मैं हूँ। And I was not sorry to, but like I thought maybe कुछ इसमें diagnosis में गलती हो गई। So I went to 3 different doctors, but all 3 of them gave me the same diagnosis। तो जैसे यकीन ही नहीं आ रहा था कि सन से एलर्जी भी हो सकती है किसी को। Now
Yes.
I'm allergic. अच्छा, फेस पे I never had an issue because फेस पे मैं हमेशा से सनस्क्रीन यूज करती थी, तो I never had an issue. But hands पे I used to use, but I guess not that carefully. तो hands पे I noticed it first, and I was having a very tough time with it. इसीलिए I'm so interested in this whole topic, just for basic knowledge होना चाहिए सबके पास, I think. So
बिल्कुल
that
बिल्कुल.
was so this was an important question. Then we have 2 more questions. Do we need yearly skin checks? हर साल हमें skin check कराना चाहिए या कैसे करना चाहिए? What is your suggestion, recommendation?
So see, एक certain age के बाद में Western world में this is an idea that you should go for yearly skin checks. Why? Because the skin cancers are very common in that Western world because their skin is very lighter, less melanin is there. India में I would say because you should follow a proper skin care, so you should go and ask and discuss your doctor because weather changes भी अलग अलग होते हैं. See, we have 3 different weathers. According to the weather, you need to change your products. And then if you have some condition, get it checked and treatment. So I would not say that there should be a fixed frequency you should go for, but mostly patients are having some skin concern, so get it treated because skin को हम क्या है seriously नहीं लेते हैं. It's not an emergency condition. Now when we don't take it in as a serious condition, what happens is कि we keep on scratching or avoiding, and जब वो बहुत ज़्यादा हो जाता है तब then you have to take a lot of treatment. So rather अगर हमें कोई भी symptom है या कोई भी issue है या we are not understanding what product we need to use, in that case better एक बार आप expert का opinion लें and then accordingly once you will go, you will become little knowledgeable about this thing कि how you need to take care of, क्योंकि definitely डॉक्टर आपकी हेल्प करेगा आपकी स्किन को समझने में, आपके प्रोडक्ट्स को समझने में, so you will understand better and then accordingly you decide your frequency, right?
Yeah. Oh, sorry. I think I pressed something anyway. Yeah. So I was trying to see if you have any questions, but अभी मुझे वो एक ही दिखा था पिगमेंटेशन वाला। बाकी लोग जिनको जो ये बाद में देख रहे हैं वो लोग, आप लोग कमेंट्स में छोड़ सकते हैं क्वेश्चंस एंड वी कैन गेट बैक टू यू अबाउट इट। तो दिस इज अ वेरी गुड एडवाइस आई थिंक कि आपका जो भी स्किन इशू है जब वो शुरू हो रहा है, व्हेन इट्स स्टार्टिंग, देन गो फॉर द चेकअप सो यू नो कि हो क्या रहा है, एक्चुअली क्या हो रहा है,
हाँ
एंड देन
बिल्कुल.
डिसाइड कि आपको क्या, मतलब कितना फ्रीक्वेंटली जाना है। एंड आई थिंक वी आर लिटिल ब्लेस्ड क्योंकि वी आर नॉट लाइक टोटली वाइट स्किन लाइक द वेस्टर्न वर्ल्ड, तो हम लोग थोड़े से ब्लेस्ड हैं, वी ऑलरेडी हैव सम नेचुरल प्रोटेक्शन, बट ऑल्सो
Right.
इसका मतलब नहीं है कि हम अपनी स्किन को निग्लेक्ट करें और वी डोंट लर्न मोर अबाउट इट, सो दैट्स द थिंग। And yes, it's almost 1:02 now, so I'll ask you one last question. What are your final words on skincare? मतलब अगर आपसे कोई बोले तो आप कैसे इसको conclude करना चाहोगे? तो skincare को.
So skin care, see, like on any aspect of our life, अगर हम उस पे focus करते हैं, so वो improve होता है. Okay. So when someone comes to me and says, I really don't have time, आप एक बार देखिए और मुझे ऐसा क्रीम दीजिए जो मेरा परमानेंट वर्क करेगा. So actually हमें टाइम के साथ में, सीजन के साथ में उसको चेंज करते रहना पड़ता है कंडीशन के साथ में, स्किन कंडीशन क्या है उसके साथ में उसे चेंज करना पड़ता है और रेगुलरली करना पड़ता है। ऐसा नहीं है कि आप एक बार करेंगे और आपको पूरा इंप्रूवमेंट हो जाएगा और उसके बाद कुछ नहीं होगा, बिकॉज एजिंग इज हैपनिंग रेगुलर, मतलब ऑन टाइम। जो हमारे एनवायरमेंटल फैक्टर्स वो हमेशा दे आर वर्किंग ऑन देयर ओन पेस, वो हमेशा काम कर रहे हैं। तो देन यू हैव टू जैसे हम घर की सफाई रोज करते हैं, राइट? या हम कुछ अपने बॉडी के लिए एक्सरसाइज डेली करते हैं, या हम खाना डेली खाते हैं, सेम वे यू हैव टू डू फ्यू रिचुअल्स ऑन डेली बेसिस एंड देन ऑन वीकली बेसिस और मंथली बेसिस जो भी है। तो आपको स्किन की केयर भी उसी तरीके से रेगुलरली करनी पड़ती है। ऐसा नहीं है कि हम एक बार ट्रीटमेंट ले लेंगे, एक बार कर लेंगे, उसके बाद कभी कुछ नहीं होगा या वैसा का वैसा मेंटेन रहेगा। नहीं, वी हैव टू डू द रेगुलर एफर्ट्स, एंड व्हेन वी डू द एफर्ट्स, ये एफर्ट्स आपको दिखते हैं, दिखने शुरू होते हैं जब आप अच्छे से खुश रह के उन पे एफर्ट्स करते हो। आई ऑलवेज से जो ब्राइड है उसका स्किन अपने आप से ग्लो करेगा इफ शी रिमेन्स हैप्पी एंड वर्क ऑन ऑल अदर थिंग्स, ऑन हर स्ट्रेस, एंड देन अगर सिंपल स्किन रूटीन भी फॉलो करेंगे तो अपने आप इट विल स्टार्ट ग्लोइंग। तो अगर आपका स्किन रूटीन परफेक्टली फॉलो हो रहा है, सो दैट इज द मोस्ट इंपॉर्टेंट थिंग यू नीड टू फॉलो टू हैव अ ग्लोइंग स्किन, बेटर स्किन, irrespective of the color of the skin. Okay?
Correct.
So that is my take on the
पॉइंट। मेन थिंग इज ग्लो आपको किसी भी कलर की स्किन में दिख सकता है। ग्लो इज अ ग्लो, चाहे वो डार्कर कंप्लेक्शन हो या फेरर हो। बट यस, एंड देयर सो मेनी टाइम्स आप जैसे व्हेन आई मीट समबडी उनसे मिलते हैं तो देयर इज जस्ट अ ग्लो ऑन देयर फेस, इज नथिंग टू डू विद देयर कलर और इट्स टू डू विद दैट व्हाटएवर, इट जस्ट अ ग्लो, आई थिंक, जैसे आपने कहा। So, Ekta, thank you for joining in. If you have questions, do let us know because we'll be wrapping this up very soon. It was a half an hour, but we've extended it by about 4-5 minutes. बीच में हमारा exit भी हो गया था गलती से. So, any questions? I have asked all my questions and I'm very happy with the answers. अगर आपके पास किसी के पास कोई questions हो, please उनको हमको भेजिए यहाँ पे कमेंट्स में। अभी भी भेज सकते हैं जो लोग लाइव है, और बाकी में you can send it later on. So that is my thing. क्योंकि I mean, I think life is holistic approach, right? कि आपको जैसे आपने कहा, you have to take care of your mental health, physical health, emotional. All of them interact and they play with each other, and that's the result on your skin. So it's कई बार ऐसा होता है you are doing all the steps but you are always stressed, तो फिर आपका स्किन का वो लेवल ऑफ ग्लो या वो लेवल नहीं आएगा जो आपका and कई बार you are very doing the right things mentally, emotionally, but you're using wrong products or wrong treatments, or you're not even going for treatment, आप जा ही नहीं रहे ट्रीटमेंट के लिए, तो उसका भी असर होता है। तो सब चीजों का असर होता है। मैं यही आई थिंक बिगेस्ट लेसन और बिगेस्ट लर्निंग यही मिली है हमको, that everything impacts.
So most of the time what happens is patients start treatment and then even after starting the treatment they have worry that will it be okay or not, how much time it will take. So again that stress is there. Now acne is already on the face and then you are having stress, and that stress keep on aggravating your acne again and again. So once you start your treatment you have to be a little patient. Skin needs actually patience, क्योंकि skin का जो टाइम फ्रेम होता है वो थोड़ा लंबा टाइम फ्रेम होता है। इट विल टेक टाइम टू शो द रिजल्ट, तो यू शुड बी वेरी पेशेंट एंड
नहीं सॉरी, you were saying.
Yeah, so you should be very patient by taking the treatment, and once you start the treatment you should be comfortable that I have started the treatment with time, because वो जो टाइम है ना, अगर हम कहते हैं बेबी को ग्रो होने का टाइम 9 मंथ है तो वो 9 मंथ में ही ग्रो होगा। अगर प्लांट को ग्रो होने का जो टाइम है वो उतने टाइम में ही ग्रो होगा। तो सेम वे स्किन जब रेस्पॉन्ड करेगी तो वो टाइम से ही रेस्पॉन्ड करेगी। ऐसा कोई मिराकुलस चीज नहीं होती कि सडनली you do the changes and that happens, except for some procedure kind of things definitely जो हम करते हैं उसके अलावा। So that is the thing. So mostly it is your routines and practices which we need to follow other than procedures.
So Nida has also joined. Welcome Nida to the live. And if you have a question, drop it in because I think अगले कुछ minutes में हम लोग इसको wrap up करेंगे. I'm just giving everyone time because there are some people right now. So I just want them to, if they have a question, please drop it right now. Because मैंने अपने सारे questions पूछ लिया and I'm very happy with all the answers. क्योंकि आपने ये बिल्कुल holistic answers आपने दिए, you know, you and very balanced answers, because that's what, and people don't know about it. That is the thing about it. Awareness नहीं है लोगों में skin health के बारे में. So that was the goal, that all the people. And about this patience वाला part जो अभी आपने बताया, you know, it took me 4 months for my skin to get fixed. 4 months. जबकि I had a very limited type of problem. It was not all over and all. तो अगर और ज्यादा problem होता, it would have taken 6 months. Who
More
knows?
time. Right, more time. So one more thing I really want to add here. Whenever we have stress, okay, whenever our skin is in stress, showing lot of things, then that is the time we need to remain calm. Don't use so many products, okay. उस समय पे only use few products, few things, so that वो आपकी जो वो condition है वो treat हो जाए. Once you have treated it, once it
Yes.
is okay, then start your routine. You know, night आपका अलग यूज करें, मॉर्निंग अलग यूज करें. जब आप बिल्कुल ठीक है, अगर आप स्ट्रेस में और उसको बहुत सारी चीजें दे रहे हैं, तो देन इट विल अगेन स्ट्रेस्ड आउट. सो आप ट्रीटमेंट के टाइम पे सिर्फ ट्रीटमेंट करें, एंड देन आफ्टर वंस इट इज गेट ट्रीटेड, देन यूज योर प्रिवेंटिव मेजर्स एंड रूटीन स्किन केयर, मॉर्निंग इवनिंग रूटीन्स एंड सीरम्स, एंड दैट इज द राइट अप्रोच एक्चुअली.
I have a question here. Nida was asking, anything we can do for long-lasting pigmentation? I think she missed the initial part when we had covered the pigmentation wala. तो अगर आप
So Nida, one thing which I would like to add here, for especially for pigmentation, for color or pigmentation, sun protection is the most important thing. Okay,
Correct.
50% is sun protection. Sun protection आपको करना ही पड़ेगा, पर अगर आप केवल sun protection भी करोगे तो आपका कलर काफी लाइट होना लग जाएगा, एंड देन उसके बाद वी कम टू द ट्रीटमेंट. सो ये सन प्रोटेक्शन इज द फर्स्ट एंड फॉरमोस्ट थिंग, एंड देन वी एड द ट्रीटमेंट, एंड देन वी एड सम डाइट्स एंड अदर एंटीऑक्सीडेंट्स. सो ये सारी चीजें मिलके अच्छा रिस्पॉन्स देता है. पर अगर केवल आपको एक ही चीज करनी है, तो स्टार्ट डूइंग सन प्रोटेक्शन. सबसे पहले उसका हैबिट बनाना शुरू करिए. Do it at least for 1 month, 2 months, and then start your treatment, and then you will get the result.
The biggest missing link in what I have understood now when I talk to people, because I am like, a lot of people ask me about my skin. So I think the one reason I can think is, from the age of 18, I've been using sun protection. And पता नहीं, I guess I was always fond of learning and knowledge was important to me. तो मैं read बहुत करती थी and I would keep myself aware. अभी भी I like to learn a lot. तो sun protection I had started very early. So that is one thing. कई लोग हैं जो at least 35 तक भी नहीं करते. They don't know about it. So what are, I think, as a, like, when someone asks you what do you do, so then you want to give them all the knowledge. That's why I thought, let us start with at least one live like this, and we'll see how it goes. So it's very important. Knowledge is power. Truly it is. अगर knowledge होगी तो आपको उसको use करना आएगा, सही तरह से use करना आएगा. And everything is treatable. Everything is you can go for, but you need to know कहाँ जाना है और कब जाना है.
Right.
वो चीज सब.
So your questions were very up to the mark, Imrana. They are really commonly asked questions, and definitely, whenever my patient comes one-to-one, I communicate it to them. But this kind of live will definitely help a lot of people to understand actually कि skin care कितना जरूरी है और कहाँ हमें vitamin D supplementation start कर देना चाहिए. And your questions were really very up to the point questions, which need to be known to everyone, right?
Thank you so much. But so I did not get any other question from this live. Let's see. Should we give them? How much time do you have? Do you have another 3-4 minutes, or you have to get back? Yeah, we have. Okay, so we'll give another last 3-4 minutes. किसी को कोई questions पूछना है? Someone wants to ask, please ask. And because I mean, I think it's Dr. Pallavi was kind enough to join. She's a busy doctor. She took out time from her day for all of us here to share her knowledge. We should honor and respect that. तो अगर किसी को पूछना है अभी पूछ. जो लोग यहाँ.
I have to go somewhere, so we can conclude now.
Yeah, all right. So I'll just give them a few seconds more. कि किसी को कुछ पूछना.
Not an issue.
तो बाद में हो सकता है we might get. Okay, someone's asking.
One more question, right?
Afreen is asking, how many times we have to apply sunscreen in a day? Very, very relevant. Yes, relevant question. कितनी बार sunscreen?
Yes, so Afreen, once we apply the sunscreen, its impact remains for 2 to 3 hours, right? ओके सो अब वी कांट डू इट इतना फ्रीक्वेंटली. अगर आप धूप में जा ही रहे हो देन तो यू रियली नीड टू अप्लाई इट एटलीस्ट 3 times. मिनिमम तो 3 times है ही. आप अगर धूप में ही काम करना है, आपको धूप में ही रहना है, बट अगर आप घर के अंदर रहते हो तो आप 2 times वुड बी सफिशिएंट इनफ. सो व्हाट आई सजेस्ट कि जब भी आपको धूप में जाना है उसके आधे घंटे पहले उसको लगाना है. और जो सनस्क्रीन हम एक बार लगाते हैं उसका इम्पैक्ट 2 to 3 hours रहता है. So according to depending upon your working conditions and your environment, you can decide how frequently you want to apply. अगर आप बीचेस पे जा रहे हो और पूरा दिन भर वहां रहने वाले हो तो 3 बार से भी ज्यादा आपको लगाना पड़ सकता है सनस्क्रीन. So that is how it goes. Okay.
Thank you so much. I think that was a very valid question and important one because when I was younger, I used to think एक बार लगा लिया तो हो गया, but as then even I got to know you have to reapply. That is the
Right.
thing. So thank you so much, and क्योंकि you have to go, so we'll wrap this up. But thank you for all your time and energy and your knowledge. And I've been wanting to do this for at least 2 years. I think finally मैं कहा चलो अब कर लेते हैं इसको. But thank you
Thank you
so
so
much.
much, Imrana, for inviting me here, giving me platform, and we have been able to discuss so many important points for everyone around us. So that's a good thing. Thank you.
You and I will have to figure it out, but either in the first comment I will leave your details for anyone who wants to get in touch with you. And आपने बताया कि आप live consulting भी करती हैं, offline and online both. So people who are not in your city, you're from Jaipur, right?
Yes,
जयपुर से हैं आप.
I'm from.
Yes, sunscreen का SPF कितना होना चाहिए? Okay, last question, then we'll wrap. Bhavika is asking. SPF
So,
कितना?
yeah. So actually SPF 30 would be sufficient if you are working indoors. पर अगर आपको बाहर जाना है, अगेन बीचेस पे जाना है या बाहर जाना है, तो आपको SPF 50-60 भी आने लग गया है आजकल. तो यू कैन यूज SPF 50 एंड देन यू शुड ऑल्सो लुक फॉर PA रेटिंग. तो अगर PA रेटिंग जो होती है वो अच्छी है, 4 स्टार है, 5 स्टार है, तो आपका UVA एंड B दोनों का कवरेज हो जाता है. तो लुक फॉर SPF एज वेल एज फॉर PA रेटिंग.
UVA UVB दोनों कवर होना चाहिए उसमें. Correct. Okay. So thank you, Bhavika. Hope that was helpful. And everybody जिन्होंने भी questions पूछे, I'm hoping it was helpful. आप सबके लिए, I personally I think I learned a lot today and directly from you, so it was fun. So thank you so much and wishing you all the best ahead. Thank you. Have a great day.
Okay. Take care. Bye.
इसको रिकॉर्ड कर दो. रिकॉर्ड हुआ. वो खत्म हो गया ना लाइव.